How do AHI and RDI differ for sleep apnea diagnosis? Imagine trying to understand how often your breathing pauses or becomes shallow during sleep. Two numbers come into play here: the Apnea Hypopnea Index and the Respiratory Disturbance Index. They might seem similar, but they tell us slightly different stories about your breathing during sleep. The Apnea Hypopnea Index, or AHI, is the most common number used to diagnose sleep apnea. It counts how many times per hour your breathing either stops completely, which is called an apnea, or becomes very shallow, known as hypopnea. For an event to count, it has to last at least 10 seconds. When your breathing stops or slows down that much, it often causes your blood oxygen levels to drop. To find your AHI, your sleep specialist adds up all these stops and slowdowns over your sleep time and divides by the number of hours you sleep. For example, if you have 30 of these events over 6 hours, your AHI is 5. Doctors use this number to decide if your sleep apnea is mild, moderate, or severe. Now, the Respiratory Disturbance Index, or RDI, is similar but includes more types of breathing issues. Besides counting the apneas and hypopneas, it also considers other disruptions called respiratory effort-related arousals. These happen when your body tries harder to breathe but doesn't fully stop airflow. These efforts can wake you up briefly, even if your breathing doesn't pause completely. Because RDI includes these extra events, it's usually the same or higher than your AHI. Think of it like this: AHI measures the big breathing pauses and slowdowns, while RDI looks at those plus the smaller interruptions that still disturb your sleep. Sometimes, someone might have a low AHI but still feel tired or restless because their RDI is higher. This can be especially true for people with mild symptoms or those who don't have many full stops but still experience sleep problems. In most cases, the AHI is the main number doctors use to diagnose sleep apnea and decide on treatment. It's the standard for insurance and guidelines. RDI isn't used as often but can be helpful if your symptoms don't match your AHI score. Some sleep centers and doctors might look at both to get a clearer picture of your sleep health. So, in simple terms, AHI measures the big breathing stops and slowdowns, while RDI adds in the smaller disruptions that can still wake you up. Knowing both numbers can help you and your doctor understand your sleep issues better and choose the right treatment.